Hi everyone, I'm Dr. Roman Hunter, and today we're going to be talking about manual muscle testing, otherwise known as MMT. Now, MMT has 6 grades, from grades 5 to 0. Grade 5, otherwise known as normal, is when the person is able to complete full range, or in other words, throughout the available range of motion, and is able to hold against maximal resistance. The muscle is able to hold against maximal resistance. For grade 4, otherwise known as good, is when the person is able to complete the full range or the available range of motion and is able to hold against moderate resistance. So if you were to apply maximal resistance and the person breaks, that would be a grade 4, right? So it's just moderate resistance. For grade 3, otherwise known as poor, or fear rather, my apologies, is when the person is able to complete full range without manual resistance. So they're able to complete full range or go through the available range or go to any range just against gravity, in a gravity maximized position. All right. For grade 2, otherwise known as poor, is when the person is able to complete partial range. They're unable to complete the full range, just partial range, or you put them in a gravity minimized position and they're able to perform the full range in a gravity minimized position. All right. For grade 1, otherwise known as trace, is when the person just has a palpable contraction or a visible contraction. And for grade 0 is when there is no visible nor palpable contraction occurring in the muscle. And 0 is otherwise known as, you guessed it, 0. All right. So when performing MMT, you want to make sure that the body part is exposed. You don't want to have it fully clothed or you have bulky clothing over the area that will limit the range of motion, and you won't be able to see any visible muscle contraction occurring. So you want to make sure that the area is exposed and you drape them accordingly. All right. Now, in terms of, just before we go, I just want to also mention that for some joints, there may be some arthritic changes that will affect the range. So the person may not be able to perform full normal range of motion just because of arthritic changes occurring within the joint itself. May also be due to capsular issues or some internal derangements occurring in the joint. So you allow the person to take the limb through the available range that they have within their capacity, through the available range, or you take them to the end of their range. They're able to take themselves to the end of their range, and you perform the test within their available range that they have. All right. So this is MMT, manual muscle testing, that we'll be talking about. Thank you very much. Model, and we're going to be doing manual muscle testing for shoulder internal rotation. That's MMT for shoulder internal rotation. Now the primary movers for internal rotation of the shoulder are the subscapularis muscle, the pectoralis major, the teres major, and also the latissimus dorsi muscle. Now, I'm going to go ahead and move into position, and I'll explain everything to you step by step. All right, so here we have our patient in a prone line. Again, just to say it again, we're going to be doing internal rotation of the shoulder, and in this position, we're going to be testing for grades 3 to 5 or 5 to 3, whichever way you want to call it. The starting position for the patient is in a prone position, right? So the patient is in prone position, the head is turned to the side of the testing arm, and you want to make sure that the shoulder is 90 degrees abducted and the arm is supported by the pillow, right? Now, the arm is supported by the pillow at the edge. The elbow, you want to make sure that the elbow is at the edge of the bed, hanging down, and the palm facing inwards. All right. Now the position for the therapist or the examiner will be pretty much at the level of the waist, more or less so. And you want to give the instruction. You're going to go ahead and just rotate the hand inwards, just lift the palm up towards the ceiling in this position. Now you allow them to go just to their available range. If this is all that they can do, then that is all that they can do, that's fine. You want to make sure that the wrist is not bending like this, and you want to make sure that it is in a neutral position for the wrist, all right? Now, they move the arm, lift the palm up towards the ceiling, and that is what they're doing. You're going to apply the counter pressure on the outside of the elbow, and this is the stabilizing hand, also applying the counter pressure, and the hand that will be doing the test, performing the pressure, will be distal forearm or at the level of the wrist, okay? Distal forearm or the level of the wrist. And the instruction you're going to get is don't let me press it, don't let me move it down, don't let me push it down, don't let me push it down. Okay, good. The very fact that she was able to perform the full movement rules out she already has a grade 3. She didn't break, so she's not a grade 4, and she's a complete grade 5, which is good. If it is that she struggles or she breaks under maximum pressure, that would be grade 4. If it is that she holds it with moderate resistance, that would be a grade 4 also. Alright? Thank you. I'm going to go ahead and show you now the test for grades 2 to 0. Alright. So now we're going to be looking at MMT, shoulder internal rotation, grades 2 to 0. As you can see here, the patient is in prone lying still, head turned towards the limb that will be examined, and you want to make sure that the shoulder is at the edge of the bed, so the whole entire arm is hanging down. Alright? This is for grades 2 to 0. And you want to also make sure for the position of the therapist, same position, nothing really much has changed in terms of at the level of the hip, and facing the patient, just in case if there is any grimacing or anything that you'd want to pick up in the facial expression. Alright. Now for grade 2, there are different ways of doing a grade 2 MMT for shoulder internal rotation. The first thing you can do is stabilize. You want to stabilize the shoulder. So this is stabilizing hand. You want to stabilize the shoulder, and then you're going to go ahead and ask them, go ahead and turn the thumb inwards for me. And you're able to perform the movement in this position. So this is a grade 2 for shoulder internal rotation. As you can see here, she's turning her thumb inwards like that. Alright? Now, there's another way in doing this. What you can also do is you can position the person, if they don't understand, you can position the person's limb. You can manually internally rotate the patient's limb and ask them to hold it there. Hold it in that position. Hold it in that position, and you're able to hold that position. And that will be a grade 2 MT for shoulder internal rotation for the group of muscles that perform that movement. All right, can go ahead and return to neutral. Now, that will be a grade 2, okay? For grade 1 to 0 now, what you'd want to do is palpate. They will usually say use one hand, palpate right the center of the axilla, and ask them to perform the movement. Now, they won't be able to perform the movement, of course, it's a grade 1, so all they're doing is feeling for the contraction of the muscle. You're using the hand, palpate the center of the axilla, just to feel any palpable contraction there going on with the muscle, while you're attempting to rotate that arm inwards, or rotate the thumb inwards, alright? Go ahead and try, and the person is unable to do it. You feel for some contraction, there is anything going on, so that will be a grade 0. If you feel for something, of course, that will be a grade 1. Now there is another alternate position for internal rotation of the shoulder, which I'll be showing you shortly. Alright, so I had mentioned an alternative position for shoulder internal rotation. Now this position is used to test for muscle strength grades 3 to 5 or 5 to 3, whichever way you want to turn it. The person is in a short sitting position, and the therapist is standing to the front side of the arm that will be tested. So let's say this is the shoulder that will be tested. You want to go ahead and put the elbow 90 degrees, keep the elbow tucked in, the elbow is tucked in, 90-degree elbow flexion, elbow is at the side, and you want to make sure that the wrist is in a neutral position, palm facing in or thumb facing up. Okay? Now, the position of the examiner, the stabilizing hand will be providing a counter force on the outside, and the pressure will be on this side. So the test will be, don't let me rotate the hand out. Don't let me rotate the hand out. Don't let me rotate the hand out. Hold it, hold it, hold it. And you're able to hold it against maximal resistance. That will be a grade 5. If it is that she broke form and she broke the pressure, then that will be a grade 4. Or if it is that the examiner used moderate resistance and she's able to hold with moderate resistance, then that will be a grade 4 also. Right? This is MMT, manual muscle testing for shoulder internal rotation. Have a wonderful day.